There's a lot not known about the actual applications of technology. We're all very excited. We're presenting about how AI is going to change things and how wearables are useful. But then we all know that there's this gap between the research and clinical application. So we wanted to see how big is this gap, and really is the knowing that we feel as experts, is that really what's happening out there worldwide? This was actually a presentation of the initial stage, which is just internally surveying the Technology Study Group of the MDS and seeing what the experts of technologies, how are they using it? And then after that, going in further and seeing how non-study group members, how they're practicing. So the main question was basically, in the last year, what proportion of your patients have you clinically utilized these technologies in? Then the next area, what is your perception of that technology? And then this important column is, I don't really know. I haven't really been exposed to it. These are the experts who are very interested in these kinds of things, but this is clinical care and not their research. I think one of the interesting findings that goes back to, how about old school technologies? How about ePro, electronic patient reported outcomes, even very established technologies, even with clinicians feeling strongly about them and that they're helpful, they're not really being implemented. Well, what are the barriers to this utilization? We kind of lump them into three categories: patient barriers, clinician barriers, and then systemic barriers. And we asked from 0 to 10, how significant is this? The systemic barriers, 6.6 on average, were rated as larger barriers. And this kind of goes with the literature as well, that there are patients that are motivated and interested in using these technologies. We're seeing that clinicians are also interested in using and think they're useful, but then there are big systemic barriers like incorporation into the hospital, into the EMR, and then regulatory aspects that are limiting its utilization. The take-home conclusion after all of those words is that despite clinical value, digital technologies have not universally been utilized. There are these barriers that we need to overcome, even for experts who are trying to push the field forward.